Hi everybody, Dr. Daniel Yinh at the Center for Musculoskeletal Function in Palm Beach Gardens, Florida. Today we're talking about the difference in location between tennis elbow and golfer's elbow. They're both repetitive overuse injuries, and despite their name, they're more commonly seen in non-athletes as opposed to athletes. In the video we're going to discuss the treatment approach, and we're also going to go over the different manifestations of tennis elbow and golfer's elbow. So these are the different locations between tennis elbow and golfer's elbow. Tennis elbow happens on the outside of the elbow. The majority of the pain is usually felt on the bony area of the elbow, with a lot of pain sometimes referring down into the forearm here. Whereas golfer's elbow is mostly on the inside of the elbow, also felt on the bony area here of the elbow and referring down into some of the areas of the muscle of the forearm here. Both of them are overuse injuries for the most part, and the tennis elbow involves the extensors of the fingers, wrist, and hand, whereas the golfer's elbow involves the flexors of the wrist, hand, and fingers. Like this. So in order to treat the tissues involved in tennis elbow, we use an instrument, and we do instrument-assisted adhesion release, and we use a beveled edge like this, which is very flat, and it allows us to get into the tissue, and because the instrument resonates, it really tells me exactly those areas where the tendon needs it most. The tendon, because it is tennis elbow, has small micro tears, which is part of the reason why these things can be so chronic. So we want to get into these areas and create stimulation so that more healing happens here, and we also want to reduce the thickened and degenerated tendon. In addition, there's adhesions that form into the adjacent tissue here, and we want to get rid of those because those are also part of the overuse that happens to this area. As you can see, as I'm working through the tissue, the area starts to turn red. That's good, that's what we want to see. We want to see the areas that we're working create increased blood flow, so that more blood can get into that tendon that's part of tennis elbow. I hope you found this information helpful, and if you did, go ahead and subscribe to our channel and give us a thumbs up, and we'll see you on the next one.